So hi guys, welcome back to another new episode of the Soulful Medic. Basically, this is the second video that I am trying to make, which is all about first aid. Now, 11 months back, I made one video which was all about why INI-CT toppers and NEET PG toppers often talk about first aid and using first aid for their preclinical subjects. And at that point, I was watching quite a lot of videos of Dr. Aditya Gupta, who has been quite vocal about using first aid for your preclinical subject, especially. Now, as a final year medical student, I was kind of very much confused because earlier I had done my preclinical subjects with my prep letter. Now I am in final year, so I was very much skeptical about whether I should change over my resource from prep letter to first aid, which is very much USMLE specific. So that's why what I did with myself is basically one of the subjects in which I am not very much confident upon is microbiology. So what I did with myself is basically I gave myself 3 weeks in which I did whole first aid microbiology, and what I did after that is solve MCQs from the FMG solutions. And the results which I got, the things which I basically noticed throughout this 3 weeks of period, this video is all about that. And I hope after the end of this video you can really decide that whether you should switch over to first aid or not in your final year. First part of the video is all about why first aid is better as compared to my old prep letter notes, because there are some points, there are some things that I've noticed in first aid which is very much indifferent from any of the notes that you would find, which is about NEET PG, whatever exams that you're preparing for. So the way of studying of first aid is basically a much more consolidated way of study, in which basically we study a lot of topics at the same point of time. Now what I mean by this, so let's just take an example of microbiology. So there are many bacteria that cause gastrointestinal infections. So what first aid does for us is basically it depicts all the bacteria's information in a kind of a table under the heading of gastrointestinal infections. And with that the very first point gets cleared that okay, these are the bacteria that are causing gastrointestinal infection. Now after that I can differentiate between each and every bacteria. Okay, this symptom is shown in this bacteria, while this other symptom is especially in this kind of bacteria. So that kind of very much differentiation that you can make between each type of bacteria helps you to retain much more information and much more smartly, so that when in the exam things are gonna come back. Basic funda of any MCQ is basically tricking you in those confusing areas where two bacteria have the same symptoms, only and only 2-3 characteristics are different, and those are the points which really come about in the MCQs. And that is where first aid trains you better compared to the older prep letter notes, because in the prep letter notes the basic flow of study is like you study one bacteria, after that you study one bacteria, or at some point you would see some tabular information only. But first aid is much more much more concentrated towards only and only consolidated way of studying all the things at the same point, trying to relate between two topics, intertopic things. And this really helps you, especially in the subject of microbiology. It really helps you to learn the things in a much better way, and you would obviously notice this, that you are able to grasp much more as compared to reading your old prep letter notes. So this was the first thing. Now the second thing is obviously the amount of notes, amount of pages that you have to revise at the last point of time. Now in the last point of time, obviously you might be having 19 subjects. So microbiology is one of those subjects, or any of the preclinical subjects is one of the 19 subjects that you have to revise while basically in a 10-day of time or a 1 week of time before the exam. So obviously we would go on with the things that is less in volume, less in quantity. So basically a common prep letter note would of microbiology is around 100 and 150 pages. In the case of first aid, it's just about 30 to 40 pages. In that 30 to 40 pages you get the very essential, very accurate, very high yield information of microbiology that you must know from this whole subject, and that is probably gonna come in each and every medical exam. So this is what first aid gives you as compared to the normal prep letter notes, or probably marrow notes also. So this is the second advantage that I felt. Okay, now after these two things, you can obviously decide to whether switch over to first aid or not. If you are in your final year and if you want to switch over to first aid, I would still suggest you go on with those preclinical subjects in which you don't find yourself confident among in prep letter notes or any other older resource that you have earlier followed. Then you can switch over to first aid and start following first aid and start annotating first aid and use it as a primary revision resource for that subject. That's what I did with microbiology. I would probably gonna do it with biochemistry also, because biochemistry is also one of those subjects which I am not very much confident upon, after even after going through a lot of prep letter videos, and earlier also I had been through a lot of resources for my biochemistry. So this was the basic essence of the video. If you really want to switch over to first aid, go on with those subjects in which you don't really find confidence upon from your earlier resources, because the time is very much important here. Because if you're in the final year, I know you might be having a lot of things going on side by side apart from your preparation. So that's why changing resource at the last point is not very good. But still, if you're not confident at the subject, it's better to change your resource and have a much more confident way of, like, have a much more confident grasp over the subject. So that was the whole point. That's all for this video. See you in the next video. Bye bye.